Hi, everyone. So I am here to talk a little bit about the Patient Advisory Council of Improved Care Now. A little bit of background. I am a current senior at the University of North Carolina. I've had Crohn's disease for 11 years now, and I'm the current co-chair of the Patient Advisory Council for Improved Care Now. So what is the PAC? Can you all see my slides advancing?
You sure can.
Okay. So what is the PAC? The Patient Advisory Council.
It did not advance. I thought you were asking if we could just see them. I'm still seeing the first one.
Interesting. That's very interesting. Okay.
Want me to go ahead and somebody just switched it.
You might. Can you just go ahead and do it? Because it's
give me just 1 sec. I'll pull them back up. Yep.
Sure. Thank you. You go ahead. There we go.
Okay.
So the Patient Advisory Council is a group of young, passionate, and motivated patients with IBD. We have an age range of 14 and up. So anyone who has been involved at a pediatric level with IBD can be involved with the PAC. Usually our patients don't really get over the age of 24 or so because people start real life, as they say, and aren't really involved with us anymore. But we have a very big range of patients who are involved. So what do? Improved Care Now values the voice of parents and patients. So we are the voice for all patients that receive care at an Improved Care Now center. We contribute to research studies. I'm the current patient representative on the research committee, for example, and I work with the produce study as well. Additionally, we share valuable experiences with healthcare professionals, researchers, and others, whether that be through independent consultations or through the toolkits that were talked about a little bit earlier. And finally, we raise awareness of IBD as well as knowledge about Improved Care Now. Next slide. All right, so I wanted to give a couple of examples of our resources. A couple of these have been talked about before, but I just wanted to make everyone aware of kind of what they look like and the purposes that they serve. So one of my favorite resources that we've created is the IBD Storybook. So what's really special about the IBD Storybook is that it's broken up into topics. So for example, here it says, why is education important to you? And it has individual experiences of patients in relation to those topics. I think the Storybook is fantastic for anyone who has been diagnosed for a while, but more importantly for people who are newly diagnosed, because IBD is a very isolating disease, and having names and faces as well as direct quotes, I think serves to make patients feel a little bit more accompanied on their IBD journey. The second one is one that's already been talked about, but it's the Ostiguy Toolkit, which helps patients with ostomies to manage their ostomies, as well as talks about patient experiences. Next slide. So one of our newest toolkits is the travel toolkit. It's been mentioned before, but some things about it are, traveling with IBD can be a little bit difficult just because of medications. I went to London for 6 months and I had to get medication waivers for my medications and keep my injections refrigerated. And this toolkit talks about a number of experiences that patients with IBD might have when traveling. And it's a really great resource if any of your patients are looking to travel or go out of the country. The second one here is talking about IBD. So these are PAC videos that we made a couple of conferences ago that were again mentioned before by Mary, I think. And these serve as great resources for patients who are unsure about how to communicate about their IBD to other individuals. Next slide. Okay, so a couple of our current projects that we're working on. So Missy talked about this in depth, but one of our current projects is the body image toolkit. I think body image is a topic that doesn't get talked about enough. With patients with IBD, we're very aware of our bodies because we have this disease, but there are a number of bodily changes that are associated with our diagnoses. Additionally, there's the nutrition toolkit, which is currently in development. We don't need nutritionals to help out, we need nutritionists. Blame autocorrect for that one. But the nutrition toolkit really will serve to identify patient experiences with different nutritional therapies, whether that be the specific carbohydrate diet or exclusive enteral nutrition or TPN, and will help, just like the body image toolkit, to make patients feel as though they're accompanied on their journey to different nutritional therapies or get advice. And then a couple of our newer ones, the Central Liaison Toolkit is a toolkit that's being worked on primarily by Becky Wolf and Rosa. And the Central Liaison Toolkit will help centers be more aware of the resources that the Patient Advisory Council creates and how to incorporate them in their centers, as well as help centers engage patients on a local level. And then one of our newer toolkits is the Accommodations Toolkit, which details ways that patients may get accommodations depending on like their place of study or wherever they live, or on planes and all of that kind of thing. And that's also currently in development. Next slide. Okay, so this is something that's really important to me, ways to use our resources. We have all of these resources available for you. Now, what do you do with them? So I am at the University of North Carolina at Chapel Hill, and I attend our weekly ICN meetings every Tuesday. And one thing we were talking about was new patient packets. So when I was initially diagnosed, I remember I was 10, so this was 11 years ago. I knew how to use the internet, and as soon as I heard my mom say the word colonoscopy on the phone to my doctor, I looked online and tried to figure out what a colonoscopy was. And I obviously came back absolutely appalled by the fact that this was something that was going to be done to me. So again, the internet is a very scary place to be newly diagnosed. And IBD is a very lonely disease, but it's great to have PAC members who are supportive. So really our resources are wonderful to include in new patient packets, or as well as in any appointments where you're having conversations with patients about any of the topics that you're discussing. You don't necessarily have to print out the documents for them. Kids these days are very technologically adept. And so they can, give them a link, tell them to go online, potentially bring it up on your computer so you can give them an idea of what the resource looks like. But again, these are vetted resources made for patients by patients that are really going to be important for the patient experience. Next slide. Okay, so how do you join the PAC? We make all of these resources. We are an advocacy organization as well as kind of a support group. And there are lots of ways for patients to sign up. So it's really, really easy. You just have to go to improvecarenow.org/patient. Scroll down to fill out the Join Your Peers form and submit, and the recruitment team will get back to you. So if you're a clinician or a parent, you can have your patients sign up while you're with them. Sometimes we find that patients won't take the step themselves, but when they have someone there who's encouraging them to do it, it's a good motivating factor. Once they get signed up, they don't necessarily have to join, but it feels nice to get an individual email from someone on our recruitment team and encouraging them to come join us and work with us. Next slide. Okay, so if you guys have any questions, this is an email where you can contact us. You can also reach out to us via our social media. We have a Twitter and an Instagram. Our Instagram is especially lively. We also have a Facebook page, which is ICN Patients, so please feel free to like and follow us. Next. Okay, that's fine. Does anyone have any questions? I know I'm kind of running out of time.
Yes. No, thank you, Kat. So there was one question in the chat box, which is, who should dietitians contact if interested in helping? And I think that's related to the nutrition toolkit. Is that PAC web address or email address the correct thing to use for that?
Yep, they can contact that email address.
Excellent. And then another really nice comment from a parent who said, I think it's amazing what the PAC, our kids have accomplished and what they're working on. One important thing to mention that they've learned from interacting with the PAC is that listening and working with them has really helped me, i.e. a parent, understand much more about their own child with IBD, as well as how other children and patients handle it. And I think that speaks to, Kat, something you said about, yes, you're creating a lot of tools, you're doing a lot of neat things that are being put out there in the world, but also you're kind of functioning as a support group, both to other patients and indeed to parents. So it's great that you're kind of serving both purposes. Another comment is, it's great that TAC members participate in research studies as subjects. Are there opportunities for parents or patients to give input or help design studies or pilots? What about product design input? And I'll just speak to that very quickly, getting back to, and then Kat, you can as well. Absolutely, if you have ideas for research studies or ways you'd like to get involved, I would go to the research section of the website and you can get in touch with us that way. And we can also kind of connect with folks offline if they have other questions or ideas for that. So at the end of the call, we'll be giving a quick refresher again about the ICN website and the different ways to connect. So that's a great way to connect if you do have research ideas. Kat, did you want to add anything to that?
Yeah, I mean, I think it's really important for parents and patients to get involved with research studies because parent and patient input is kind of a gold standard for a well-created research study. So your input is always, always valued.
Okay, I'm going to turn it over to Deb Ostiguy. Let me see if we can hear you, Deb.
I'm on. Can you hear me?
Sure can. I'm going to go ahead and advance your slides for you, so I'll let you dive right in.
Great. Awesome. Hi, I'm Deb Ostiguy. I'm the co-lead for the Parent Working Group. Next slide, please. So the background on the group, and we're going to be talking about some recent projects, some upcoming projects, hopefully, and opportunities to get involved. So that's a little bit of an overview of what I'm going to talk about. Next slide, please. Okay, so just to give you a little bit of background about myself, I was diagnosed with Crohn's disease in 1984. So we didn't have anything as amazing as improved care now back then. I also have an older brother who has Crohn's. And when I was first diagnosed, I was embarrassed and I didn't talk about it. Only my closest friends knew. I'm retired from a career in emergency medicine, and I was an instructor coordinator, so that's why I don't have any trouble talking in front of groups. At the age of 9, my only son was diagnosed with Crohn's disease. So this was a huge game changer for me. Maybe not, I hope a lot in my lifetime that we will find a cure. But the reason why I got involved was because I wanted to at least help my son through his lifetime dealing with IBD. So parents and guardians of children with Crohn's disease and ulcerative colitis are committed to enhancing the quality of life for the young people and their IBD families who live with IBD. So as parents, we can have a voice about the need to transform care. We can identify best practices, lower drug costs, increase remission rates, and be more informed about things like step therapy, where the insurance company makes you go through what we call a fail first with drugs. They make you try a certain drug before they let you go on the drug that the doctor wants you to go on, and make more informed decisions about treatment and how insurance companies, we feel, really shouldn't have the choice about that step therapy. Next slide, please. So currently we have 282 on our mailing list, and it's growing every day. We have 101 registered for the monthly calls. We have monthly calls, all calls, which means any parent with a child with IBD can come on our all calls. And usually about 20 to 30 parents attend these calls on a monthly basis. So Improved Care Now is much more than an improvement network. It's a community in which everyone, clinicians, parents, patients, have a role in making the care and outcomes for kids with IBD better. So each member of the Improve Care Now Parent Working Group is an essential and valued part of the community, which helps ensure that our network level projects and activities are designed around and grounded in the needs of the patients and their families. So you'll see this is how our parent working group works. We have two co-leads, myself and Bev Blosser from Dayton, who's very good friends with Shelley, who you heard from earlier. And then we have some subcommittees. So I know someone had a question about research, and there are places for you to be in our research subcommittee if you're interested. We also have conference planning, which we may be changing to strategy planning. We have communications. We have a newsletter that goes out monthly. Maria Lester and Kathy Rigg do a wonderful job putting out the newsletter on a monthly basis. And then we also have a membership committee where if you sign up as a parent, you'll receive either an email or a phone call from, we have 10 members on that, because of course, not just one member can call back all the parents who may be interested. So the nice thing about Improve Care Now is you could be on the national level with us, or you could just work at your local level. So Improve Care Now has worked hard to help parent leaders build a sustainable parent working group structure and make sure that the key Improvement Care Now project teams have feedback and activity involvement from parent partners. And of course, parent attendees can help make our annual community conferences more vibrant. And while this national level partnership is exciting, is so too the extent in which parents are becoming more involved as parents with their local care centers. There are many roles and experiences and levels at which parents can be involved, and you can tailor your involvement around your skills and your schedule. And I just want to reiterate what Shelley had said earlier. No matter what your skills, no matter what your interests, we can help you find a spot on our team. Next slide, please. So recent projects. Next slide, okay. So the importance of mental health, which Lisa Pitch also talked on, but we also had Margot Barnes and 20 parents were in attendance on one of our webinars to learn about mental health and depression screening. I think that I'm okay with talking for most parents that they believe that when their child is first diagnosed, they should have a baseline evaluation done by a mental health care provider to make sure that they're not going into a depression or having troubles with coping with their disease. We also have transitional people who have talked on our webinar calls. Diane Escar, about she's on our transitional task force from pediatric to adult care. There were 19 parents in attendance on that phone call. And it was very important because I had a parent once say to me, you know, my son used to be the king of the infusion center, and everybody was like, yo, Joe, it's you, yay, you know. And then when he moved to the adult care infusion center, he was bed 3. So that was very daunting to him, and he wanted to go back to pediatric care where he was the king again. And so we want to make that transition smooth so that children are able to make their own appointments, they know what meds they're on, and they can make their own informed decisions once they move into adult care. Next slide, please. So as I talked before about research subcommittee, Derica Day is our lead parent on that, and he is working on different projects that are very interesting, and I'm sure he would love to have a conversation with any parent who would like to come on to that subcommittee. We also have started a parent directory, should be out shortly, so that way if you know that there's a certain parent who is really involved, like Giselle Woodward is very involved with the SCD diet, and you're interested in learning more about that, you could go online because it would be on the exchange, and you could find her name and number and give her a buzz to find out how to do that. Next slide, please. We did have an IBD Cook Night with Mary McGowan, who also is very well versed with the Pacific carbohydrate diet. These are things that you can do at the local level. If people are interested in learning on new recipes and how to get the whole family involved in the SCD diet, this was incredible, and she did a wonderful job with Dr. Jennifer Burgess. So next slide, please. So how can parents get involved to make the parent working group and make a difference? So when my son's gastroenterologist said to me, would you mind if I put your son's data in a database called Improve Care Now? I was like, yes, absolutely. Anything that's going to help his care. And then he asked if I wanted to go to a conference in Chicago, and I said, yes, absolutely. My feeling is, and I know not everyone feels the same way as me, but I'm very passionate about this. And if your child is not being seen at an Improve Care Now center, I really don't believe they're getting the best possible care. Just think of you as a parent sitting side by side with clinicians, doctors, dietitians, psychologists, and they want to hear from you. And they're not on a pedestal. You're shoulder to shoulder with them, and you're discussing these issues and these problems, and they want to hear from you. And you definitely have a voice. So parents are not only important Improve Care Now collaborators, but also we have busy lives as caregivers, friends, and professionals. And we keep learning how to help ensure that parent participation is meaningful, and Improve Care Now works with parents, patients to create new opportunities that have an impact. Improve Care Now encourages parents to keep sharing their ideas and becoming involved at your local care center or at the national parent working level, whatever you feel comfortable with, and leading the way to getting our children into remission. Next slide, please. So you can join us for our monthly, it's the second Sunday of every month, our parent working group calls. They're all calls. Join the parent working, you can join a parent working group subcommittee if you feel so inclined. We have research, membership, communications, and community conference planning / strategy planning. And then you can come to the conference to meet other parents, network, and brainstorms. You know, I often say the clinicians are the experts on the medicine, but we as parents are the experts on our children. When we collaborate, exciting things and ideas happen, and we could sit around and wait for something to happen, or we could step up, become involved, and make things better for our children, because we are the cure waiting for the cure. Next slide, please. So how can parents get involved at their care center? So you could talk to your child's gastroenterologist about Improve Care Now, or if you are a gastroenterologist or a nurse and you're looking for that special parent and you're not sure how to find that parent, please reach out to the parent working group. Or if you can't find that PAC member, please reach out to the PAC. That's what we're here for. We're here to support each other, to give you ideas on how to find that parent. And then sometimes I get a care center say to me, well, I have one parent, but now I don't know what to do with them. I could go into it for an hour of what you could do with them, but I don't have that time. But please reach out to us. We are here for you. Attend a quality improvement meeting at your care center. Work side by side with the care center staff. You can go to the ICN exchange. You can steal shamelessly and share seamlessly, and see the parent page, and contact veteran parents for advice or ideas. Any of us. There's not one parent on my parent working group who would say, no, I don't have time to talk to you. It's a very intelligent, smart, friendly group of parents. Next slide, please. So getting involved with the parent working group. Here are our websites. Our staff liaison is Michelle Spots. I don't know what I would do without her. You can also contact her if you're trying to reach me or Bev or anyone that you see on the exchange that you think you need to have a discussion with. It's pretty easy. And then one of our membership committee members will either email you or call you and then give you the invite to come to our webinar calls. It's fairly easy to come involved. You know, a lot of times I have parents who say, well, it's wonderful what you're doing, I just don't have the time. And then I always do the hard ask. I say, okay, but when will you have the time? Because this is so important for your child's care. So as you can see, I have a lot of passion, very dedicated. I've been with Improve Care Now for over 5 years, and I don't see it ending anytime soon, even when I step down as co-lead. I really believe, and they have proven it through data and research, that when you work together, you really can get our kiddos in remission. Next slide, please. And this I stole off a Smart Patient slide, because I am so happy to be connected to all of you. I am humbled. The research, the intelligence, and the passion of the parents of the kids with the IBD is phenomenal. And I feel as though I am honored and humbled to be working with such a great staff and executive board. And I could go on for an hour, but I won't. So if there's any questions, feel free to put something in the chat box, or else you can contact me directly. Thank you for having me on.